Good afternoon. It is Friday, May 29th. I am joined by Dr. Joneigh Khaldun, our Chief Medical Executive, Jeff Donofrio, the Director of the Department of Labor and Economic Opportunity, Brian Calley, the President of the Small Business Association of Michigan, Dave Dittenber, the CEO of the Downtown Restaurant Investments in Midland and Bay City, Mark Burton, the CEO of the Michigan Economic Development Corporation, and Tony Tomczyk, the Vice President of Corporate Services and Chief Procurement Officer at DTE Energy. Glad to be with all of you today and wanted to highlight this amazing mask that Dana Keller sent me. It's got the state flag and the red robin, so thank you. Michigan businesses have faced unprecedented challenges in the last few months. I know that there are many people who have spent a lifetime building up their business and they are terrified they might lose it. People who have had to lay off employees who were like family to them. It's been a hard time, but my team and I have been working around the clock with our partners in government, in business, and in labor to provide some support for those who are struggling. We've worked with the federal government to secure support for small businesses who need it. And Lieutenant Governor Gilchrist and former Lieutenant Governor Brian Calley teamed up to encourage small business owners to apply for the Paycheck Protection Program. Now, as we work to phase in sectors of our economy, I'm going to continue to work with our leaders in business, many of whom are here today, to ensure that support for businesses and workers, that they've got that support as they get back on their feet. I take the counsel of experts seriously when we're working on solutions for our state. And today, I signed an executive order creating the Michigan Workforce Development Board. The board will be vital in continuing our efforts to grow both our workforce and our economy, and will help us reach our goal of 60% of Michiganders with a post-secondary degree or certification by 2030. It brings together leaders in business, labor, and education to help ensure that in Michigan, the state that built the middle class and put the whole world on wheels, in our state, everyone has a path to opportunity. Now, all of us know the importance of getting people back to work and getting our economy moving again. The goal of the My Safe Start plan is to engage our economy thoughtfully and deliberately so that we avoid a second wave of infections, like we're already seeing in other countries and what appears to be happening in some states. The worst thing we can do is open up in a way that causes a second wave of infections and death, puts our healthcare workers at further risk, and wipes out all of the progress that we've made, not to mention lengthens the amount of time that we are in economic distress. As we've begun to phase in sectors of our economy, my number one priority has been doing so in a way that protects us, workers, customers, our families. Over the past several weeks, I've announced a series of measures to ensure businesses adopt strict safety measures to protect their employees and their customers. And I know that businesses want to get this right because they need to make sure their employees are safe on the job. It means making sure that everyone has the appropriate PPE and can practice social distancing, and ensuring training for workers that covers workplace infection control procedures, the proper use of PPE, steps workers must take to notify the business or operation of any symptoms of COVID-19 or a suspected or confirmed diagnosis of COVID-19, and how to report unsafe working conditions. As businesses in Michigan slowly ramp up again, we are willing and working to alleviate stress as much as we can. A major form of that support for business comes from the Michigan Workshare program. Workshare benefits both employees and Michigan businesses, and we hope that our employers will take full advantage of it. The Workshare program helps employers bring back workers from unemployment and restart their operations. Through executive order, I've expanded who can participate in Workshare, both for employers and employees, offering employers greater flexibility as they restart their businesses and expanding eligibility so that more employees can be hired back from unemployment. With Workshare, an employee who has seen their hours and salary reduced due to the pandemic is not only paid by their employer for hours that they work, but they're also eligible to receive both state unemployment benefits and the additional $600 federal payment in federal pandemic unemployment compensation through the CARES Act through July of 2020. So in other words, this gives flexibility to employers who are not able to perform at 100% capacity to retain their skilled workforce while saving costs in their payroll. This also allows employees to keep their jobs and to collect some unemployment for the hours that they've lost. Rather than the standard unemployment insurance, Workshare could be viewed as employment insurance, a safety net, a program that helps workers employed, allows employers to show employees that they care, and allows employers to keep their talent. Mark Burton is also here today to talk about the MEDC's program to help employers secure PPE for their workers. On Wednesday, the MEDC announced that the Pure Michigan Business Connect program has developed a portal specifically designed to support the PPE needs of Michigan businesses as they start the process of reopening. We want to ensure that opening up in a way that is safe and smart does not undo the progress we have made in flattening the curve of COVID-19. So through the MEDC's PMBC COVID-19 procurement platform, we can help employers access the PPE that they need to ensure that their employees feel safe coming back to work, and also supports Michigan businesses that will be critical to our economic recovery efforts by connecting employer needs with those businesses that have the capacity to manufacture these critical supplies. Supplies like face masks, face shields, gloves, goggles, and other materials necessary to ensure the health and safety of employees and customers alike. The portal is open to all companies, all sizes and industries, and is available for all scales of PPE demand. It is also building on a proven model that helped to connect human and health service providers in the fight against COVID-19 access to businesses within the state that are providing supplies, including PPE, food, medical devices, paper products, and cleaning equipment, and more. So we know this model works, and we hope that people make use of it. To date, more than 900 Michigan companies with procurement needs registered through the portal, along with nearly 1,800 suppliers. One of those companies was DTE, who connected through the portal with Detroit City Distillery, a distillery that adapted its manufacturing in just 72 hours and started to produce hand sanitizer. Examples like these illustrate why Michigan is the arsenal of innovation. And as we look ahead to our economic recovery across our state, MEDC initiatives like this procurement platform will be vital to supporting business across the state and ensuring that we re-engage our economy in the way that protects our health. This has been an unprecedented few months for our state. And to reopen sectors of our economy the right way, we've all got to keep working together. The leaders on this stage are making tremendous effort to protect workers and customers and our families. As we continue to navigate our new normal during COVID-19 pandemic and beyond, I will continue to work with everyone who is committed to protecting our working people. I'll keep putting our workers' health and safety first and keep working to ensure solutions for business so that as they've struggled to get back on their feet, they can do so in a way that helps them be successful. Today, you'll hear from a group of people who share that same goal. On Tuesday, this coming Tuesday, I will be testifying before a congressional subcommittee on energy and commerce oversight and investigations with regard to COVID-19 responses in the states. I will be joining Governors Jared Polis from Colorado and Asa Hutchinson from Arkansas. I want to thank Chairman Frank Pallone Jr. and Chair Diana DeGette for the invitation. Here in Michigan, we have taken aggressive action to fight COVID-19. Our actions are working. Our case numbers are dropping, and we are ramping up testing and working through our plan for a real engagement of our economy in a way that protects our people. There is no question there is more work to do, and we must all keep doing our part. But I look forward to sharing the details of Michigan's COVID-19 response on Tuesday. We have an opportunity to show that Michigan is a leader, but we all must keep doing our part. Orders don't fix the problem, it's the response to them that do, and every Michigander should be proud of what we've accomplished. Let's not drop our guard now. With that, I'll introduce Dr. Joneigh Khaldun.
So thank you, Governor. Today, we'll be announcing 56,621 cases and 5,406 deaths. The cumulative percent of positive tests in the state remains at about 13%, but for the past 7 days, the average is just over 4%. That is really good news. We've also nearly reached our 7-day average goal of 15,000 tests per day. We continue to work with local health departments to expand testing, and this weekend we will again be testing, this time in Mackinac City, Albion, Flint, Wayne County at the Westland Mall, Traverse City, and in Midland. If you will be in these communities over the weekend, please reach out to obtain a test. As I've said before, we've significantly expanded our testing eligibility criteria so that most people are actually eligible to receive a test, and you do not need a doctor's order anymore. We have over 250 testing sites across the state, and to find one, all you need to do is either call the MDHHS hotline at 1-888-535-6136, or you can go to our website, www.michigan.gov/coronavirus test. As we continue to aggressively increase testing and the downward trend in cases continues across the state, in the upcoming days, we will be able to move forward different regions of the state in the next phases of the My Safe Start plan. We also know that we have to protect the most vulnerable from COVID-19, especially people who are living in nursing facilities. Michigan, just like many states across the country, is seeing a devastating number of cases and deaths amongst nursing home residents. To get a clearer picture of the situation in nursing facilities, we've revised the state's reporting structure so that it better aligns with the newly released CMS guidelines at the federal level. We've provided this further guidance to our nursing facilities on these reporting requirements and have released this new updated data on our website today. As of this week, with 91% of facilities reporting, we know that 4,949 cases of COVID-19 have been in nursing facility residents across the state, and preliminarily, we know of 1,216 deaths. Almost 23% of all COVID-19 deaths in Michigan are in nursing facility residents, and we think with improved data reporting, that percentage is likely even higher. These deaths are incredibly heartbreaking, and we take this very seriously. We must do everything we can to ensure that our elderly and our most vulnerable are protected from the virus and are receiving the absolute best medical care. And we also know that reporting data alone is not enough. We now are partnering with district response teams led by the Michigan State Police and local health departments to expedite testing of nursing homes across the state. In addition, we have infection prevention and assessment teams, or IPRAT we call them, and they've been working with local health departments to do assessments of nursing facilities throughout the state. These teams have provided assistance to 278 nursing facilities, and they're doing things like making sure they're implementing best practices when it comes to isolation, screening residents and staff for symptoms, and the use of personal protective equipment. We've also created regional hubs across the state, and they are now approved based on their ability to provide high-quality care to nursing facility residents and making sure they have the appropriate staffing, PPE, and ability to isolate residents. We now have 663 of these hub beds available for nursing home residents who have COVID-19 but do not need hospital-level care. These steps that we've taken are incredibly important and will help to save lives, and we will continue to do even more to make sure our nursing home residents are protected. Finally, as we come to the end of Mental Health Awareness Month, I want to remind everyone that while we often focus on the physical consequences of COVID-19, we cannot forget about the need to take care of our mental health. This is a stressful time for everyone. People have lost jobs, they've seen loved ones become ill and die, or they're trying to work while figuring out how to educate and care for their children, and I certainly am. Since this crisis began, the Michigan Department of Health and Human Services has been expanding available resources to help people through these difficult times. The Michigan Stay Well Counseling Service is available by calling our COVID-19 hotline, and that number is 1-888-535-6136, and you can dial 8. Confidential and free counseling services are available 24 hours a day, 7 days a week, and we also have language translation services available for that line as well. For people who are suffering from emotional distress and anxiety because of this crisis, but they prefer to text someone as opposed to a phone call, all you have to do is text the word RESTORE, RESTORE, to the number 741-741, and you can get support 24 hours a day as well. This and other services are available at our website at www.michigan.gov/staywell. I also want to thank the Michigan Mental Health Association. They've had nearly 500 mental health professionals sign up to volunteer their time and services to assist those in need, and we're grateful for their service. This crisis has been difficult for everyone, and life as we know it will be different for a while, but we can get through this. Let's protect ourselves and each other by continuing to wear masks, maintaining an appropriate 6-foot distance from each other, not gathering in large crowds, and washing our hands often. And make sure you're taking care of your mental health, getting exercise, and checking in on loved ones and family members often with a phone call. We truly are in this together, and with our continued patience and vigilance, I'm confident we will beat COVID-19. And with that, I will turn it over to Director Donofrio.
Thank you, Dr. Khaldun. As the governor mentioned, and as we know, businesses across Michigan are having to adjust their operations due to COVID-19, both to keep workplaces safe and adjust to the current economic realities. LEO is working to help in both of these areas. First, to keep workers safe and workplaces safe. In addition to having recently launched the COVID-19 Workplace Safety Hotline, today we launched a new website for COVID-19 workplace safety. Michigan.gov/COVID Workplace Safety is the one-stop stop for safety resources as businesses begin to reopen. There, employers and employees can find COVID-19 safety guidelines by industry, educational videos, downloadable posters, and sample workplace safety plans. We also know that as businesses begin to restart their operations, many will, because of COVID-19, do so with reduced capacity and reduced customer demand. Businesses may be worried about how to retain their workforce or bring back employees from layoff if wages and hours may be reduced as a result of COVID-19. That's where Michigan's Workshare program comes in. The program allows employers to bring back employees from layoff with reduced hours, while still allowing those employees to collect partial unemployment benefits. Here's how it works. Employers can sign up for Workshare at michigan.gov/UIA. And as the governor mentioned, employees who are participating in Workshare receive a percentage of their state unemployment benefits, the additional $600 in pandemic unemployment compensation through July 2020, and reduced wages from their employer. It's a win-win for businesses who can save thousands of dollars on payroll while bringing back employees faster and in greater numbers, and for employees who are able to make up for lost income through unemployment benefits. Already, tens of thousands are participating in the Workshare program. With the governor's expansion of the Workshare program through executive order, most employers now qualify for the program, regardless of the age of their business or a balance with the UIA. The coverage has also been expanded to both full-time and part-time permanent workers with employers. Furthermore, with this being an entirely federally funded program through the end of the year, for each additional person we enroll in Workshare, it takes pressure off of the state's trust fund. To get started, employers can go and explore more information on the website. They can find video tutorials or sign up at michigan.gov/workshare. Again, michigan.gov/workshare. I'm excited that there are a number of businesses and representatives of businesses here who will be able to talk about the firsthand experience they're having with the Workshare program. How for the next 2 months in particular, this provides a really important way to get employees and employers back to work. So I'm going to announce and bring up to the podium next Brian Calley, the president of the Small Business Association of Michigan.
All right, thank you, Jeff. And I thought I'd start just with acknowledging these two interpreters, our total rock stars. Thank you guys for what you do. The Small Business Association of Michigan represents 28,000 small businesses across literally every county in our state and in every industry that you can think of. We started talking about the Workshare program several weeks ago when the eligibility was expanded, and recognized it straight away as a really important tool for businesses as they look to deal with the current economic realities that they are facing. But it's also important for the restart of the economy. Small businesses are very unique. They have different needs and, of course, very different sizes. And the flexibility of the Workshare program is a really important feature, and one of the reasons why we believe it's universally or nearly universally relevant for most businesses. You can use it a little bit or a lot. You can use it for just 1 or 2 employees, or use it for all of your employees. And it also allows for reliability and certainty. You can have a Workshare plan approved for up to 52 weeks. And if you don't need it that long, there's no problem with canceling it or stopping it early. This is a really important tool. Every once in a while, one of those programs comes along that stands above the others in terms of its relevancy to what businesses need. And this is one where we have asked our members to, if there's one thing that you look at in terms of the tools that are available to you right now, that we think that this is that important, that every business should take a look at it and consider whether or not it is right for your workforce. And as we know, over the coming weeks and months, that demand is going to ebb and flow. We hope there's a lot more flowing than ebbing in the future, but the Workshare program allows the workforce itself, the team within that business, to change with the cash flow of the business, and yet the employees are still fully paid. And so it's a really important tool. I thank the department and the governor for the work to expand eligibility, and also the forethought in ensuring that it works. It can be worked and made to harmonize with the Paycheck Protection Program. I'd like now to introduce Dave Dittenber, who is the CEO of the Downtown Restaurant Investments. Dave.
Thank you very much, Brian. I appreciate the opportunity to be here today to share my experience with the Workshare program. As an employer, I can testify to the truth of what the governor said. Our employees are like our family. We will do whatever we can do to alleviate pain during this very difficult time. Workshare is not a cure-all for everything, but it certainly has helped my business. I'm sure if more business owners and employers knew about it, they would also benefit as well. Here's what I want to share with my fellow employers. The Workshare program is an excellent and economical way to retain your employees. The program has allowed us as business owners the flexibility to bring back our employees to work in a way that fit our needs, allowing us to utilize our most talented employees with reduced hours and compensate them properly for their hard work, which in turn allows us to meet the needs of our precious customers. The program has also created excitement for our employees coming back to work, allowing them to potentially earn more by participating in the Workshare program than if they stay on unemployment, and giving them the opportunity to be trained with our new safety measures and guidelines. Getting started was simple. I logged into my employer MIWAM account on the unemployment website, created a simple plan, and updated my employees' information, and was received approval within 24 hours. I am very happy to report that the program has also allowed our employees to keep their health care and retirement benefits. My hope is that other employers in our great state will take advantage of this program to help them meet their unique needs and provide financial stability to their employees. For them, their employees, as they restart their operations, it's been a great program for us, and I appreciate the opportunity to be here to share my stories with you.
Good afternoon. My name is Mark Burton, CEO of the Michigan Economic Development Corporation, and I wanted to actually start and thank Dr. Jay and Governor Whitmer for the leadership they've shown over the last few months. The state certainly appreciates it. At the MEDC, our Peer Michigan Business Connect COVID-19 procurement platform is a key part of our efforts to create programs and repurpose existing resources to support the companies and workers on the front lines of COVID-19 while providing economic relief around the state. Since 2011, PMBC has facilitated more than $11.1 billion in new contracts, supported 54,000 Michigan jobs, and provided business connections across 79 different industries. Streamlining the procurement process to provide opportunities for Michigan businesses to grow here is what PMBC is all about. We have harnessed those years of experience and connections to address procurement challenges around COVID-19 head-on. That includes helping employers access the PPE and other materials they need to support their employees' safe return to work while also supporting Michigan businesses. And we know the demand is there. Since Wednesday alone, we received submissions from over 1,000 businesses with needs for PPE procurement. We also know Michigan companies are uniquely suited to retool, ramp up production, and innovate to meet that demand. Companies like Detroit City Distillery, who the governor mentioned earlier, adapted its manufacturing facility in 72 hours to produce and distribute 21,000 gallons of hand sanitizer for the region's first responders and essential businesses, including DTE, who's here with us today. Helping to drive the arsenal of innovation in this state, MEDC awarded 12 small businesses and nonprofits around Michigan a total of $1 million in grants through PMBC to help retool and produce critical health and human service supplies in response to the outbreak. This effort is expected to support the production of more than 5.5 million individual PPE supplies right here in Michigan, and to provide these companies with access to new customers and growth opportunities. Over the past 2 months, we have responded with agility to expand existing programs and develop specific relief efforts to face the current crisis, like the demand for PPE, while keeping our attention on the future economic needs of the state. To that end, we successfully deployed 14 different response programs that have allowed us to support more than 2,700 companies and help retain more than 11,000 jobs for Michigan workers. At the MEDC, we have also been very intentional in ensuring we are driving outcomes in every region of the state and creating equitable opportunities for access to capital and other critical support. And even as we continue to respond to immediate needs, it is vital that we also stay focused on restoring economic prosperity for all Michiganders. We must continue to support the businesses and the community projects that will secure the long-term economic health of our state and our citizens. We know that many businesses continue to face uncertainty right now, and our economy is going to look much different than we are used to, especially over the next few months. But MEDC is committed to using every resource to support relief and recovery efforts as our economy begins to reopen once more. Michiganders have been through tough times before and come out the other side stronger, smarter, and more determined than ever to succeed. And this time is no different. We'll lean into what we do best as innovators, designers, and builders to ensure our state and country has access to the goods, services, and care they need as we begin to re-engage our businesses and communities once more. It is in this spirit that we developed the PMBC COVID-19 procurement platform and are working with partners across state government, including MDARD and LEO, to make it as easy as possible for employers in this state to access PPE produced right here in Michigan. With that, I will be turning it over to Tony Tomczak, Chief Procurement Officer at DTE, to share the success they have had in utilizing COVID-19 procurement platform. And DTE was a founding member of PMBC, and last year committed to using the program to spend $1.5 billion with Michigan suppliers annually through 2024, including $2.5 billion in spending with diverse Michigan suppliers during that same 5-year timeframe. We appreciate the partnership, Tony, and we welcome him to share his perspective.
Good afternoon. I'm Tony Tomczak with DTE Energy. I'm the Chief Procurement Officer and Vice President. DTE has no more important priority than health and safety. So when the pandemic came about, we had to find our most critical partners to help us with sourcing products to keep our employees, our customers, and our communities safe. Pure Michigan Business Connect was one of those great partners that helped us. We've been a leading investor in Michigan business for over a decade now. Today, we continue using our procurement dollars to help local businesses through this toughest of times and through this crisis. 92% of our spend with initial COVID supplies has been with small Michigan businesses, $15.3 million worth. We also spent $9 million with minority suppliers here locally. To achieve these results, we relied on relationships from a number of organizations, with notably Pure Michigan Business Connect being the biggest. We also utilized the Michigan Minority Supplier Development Council to help us through this crisis in a very big way. Through the PMBC database, we quickly connected to new and small local suppliers selling the products we needed. We've mentioned the Detroit City Distillery. They provided over 3,000 gallons of hand sanitizer in our greatest time of need. We also have bought 600,000 face masks from a company called National Filters located in Harbor Beach. PMBC is excellent in finding resources for businesses transitioning to in-person operations over the next few weeks. They've helped us to lower costs by finding companies locally that are ready to manufacture and ready to provide those things that we need the most. It gets rid of all the overseas shipping costs and delays and really supports the Michigan economy. Beyond traditional procurement, we're also finding new ways to help and support business in our communities. Last month, we partnered with Choctaw Call, a Detroit minority supplier and partner to DTE, to provide 2 million KN95 masks to first responders in a time when they needed them the most. Earlier this week, we joined the City of Detroit and others to launch Detroit Means Business. The website and playbook provide all the information a small business needs to keep employees and customers safe as they reopen their doors. As a part of that effort, the DTE Energy Foundation donated enough masks, hand sanitizer, and gloves to create 6,000 startup kits for small businesses. We're proud of these efforts because we realize small and medium businesses are the key to our economy. They provide jobs and they keep employees working. Together with the PMBC, we're proving that through this crisis, we can help our business community keep employees and customers safe, and get the doors reopened and make things happen in the best way possible. Thanks for the opportunity to speak today.
Wonderful. Well, thank you all for participating today and your leadership. We really appreciate it. Happy to open it up for a few questions.
Governor, you've acknowledged a number of times that there have been a lot of hardships for people in the state. I know you're very well aware of that, particularly for business owners, and you've been talking about a lot of that today. But I hear from people, as I'm sure you do, on a daily basis. One family-owned restaurant in Grand Rapids with 2 locations, and they're concerned that if their inability to open in a more robust way doesn't come around soon, that 45 people are going to be permanently unemployed. A family-owned hair salon of 19 years said they don't know how much longer they can hold out. I understand your reasoning, and you've mentioned it several times. Is there anything you can do to offer folks like that, particularly family-owned businesses without a lot of resource, some hope as we move forward?
Well, absolutely. I think that one of the things that we should all be very proud of is when we look at where Michigan is on the national map, we've made incredible progress. And it's because the vast majority of people in the state have taken this seriously and done their part. It is because of that that we are continuing to turn the dial and re-engage additional sectors of our economy. I believe that if we continue on the trajectory that we are on in the coming days, we'll have additional regions that will be looking to moving forward. And as you know, everyone wants to know precisely when that's going to be. And I think that's one of the frustrations that is real. It's legitimate. I have the same. And yet we know that we've got to follow the data as we continue to ramp up and identify where COVID-19 is and trace. We're going to be in a much stronger position to make sure that as we reengage, we're going to stay safe in that. And I know that there are people across our state who have spent a lifetime building a business that is now precarious, or to put it lightly, and I know that they're worried. What I can say is that because of where the numbers are headed, we feel confident that if it continues, that we will be in that position to continue this reengagement and stay reengaged. And I know that's what everyone wants. The business, the family that owns the salons or the restaurant, the worst thing would be is if we went back to business and then had to shut down again. As tough as this moment has been, we've saved a lot of lives and we're making progress. But if we have to start moving backward because people drop their guard or don't take this seriously or stop wearing masks and observing best practices, we'll be back where we started, and none of us can afford for that to happen. As tough as this has been, that would be devastating. And so I just, to the people who you've spoken with, to people across the state that feel that same way, please know that I am as eager to keep turning this dial and re-engage as anyone. I just want to make sure that when we do, you're going to be safe, your employees are going to be safe, your families are going to be safe, and we don't have to move backward.
Governor, we did see some new nursing home data on the state's website today, but we're still not seeing nursing home deaths online, and it also doesn't include reporting data for some of the long-term care facilities like the assisted living spaces. We keep hearing that the state has a plan for this types of reporting and increased testing, but what does that plan exactly look like? As far as what is your progress on that, and when will we see this, and how reliable will it be?
So this is one that I'm going to hand over to Dr. J.
So that is a great question, and I'll tell you, I myself am frustrated as well. Our data reporting systems for public health, whether it's hospitals or just people getting a test, they have not kept up with what we need to be able to fight this pandemic and get people the information as quickly as we should. So CMS put out guidelines, as I've mentioned earlier this week. They put out guidelines recently. We had to align our guidance to the nursing facilities with those guidelines. Today, just a couple of hours ago, we made sure after cleaning all of the data, it doesn't come in perfectly. We have to clean it and make sure there's no duplicates. So right now, as of today, we have the cases by facility on the website. You can even see who actually did not report as well. We still have to work on the deaths. What I don't want to do is put up data that's not accurate. What we know is that there are some facilities that are reporting to the local health department, but they're not reporting to us, and we have to understand what that means and put that up as well. But our goal is to be able to report as accurate as we can, death data, and also we are gathering information from those additional facilities that you said as well. But again, we got to get it right. We have to make sure people understand what to report, and we'll continue making progress with that.
This is for the governor. So you said yesterday that we shouldn't stick to the July 1 deadline for getting the budget done, but there are still school districts, local governments that need to know how much money they can expect from the state because they have their budget years beginning then. When will they know what to expect?
Yeah, I'm acutely aware that local governments and school districts have their budget year begin at July 1st, and that's precisely why I tried to get that budget done last year on time, and of course it wasn't done until the last moments. The fact of the matter is, right now we've had to, because of COVID-19, deal with this massive economic hole that it's created in our budget. It is my fervent hope that as I testify on Tuesday before Congress, that I can tell the precise story of what is happening here with regard to these shortfalls and what's at risk here. In the midst of a pandemic, it would be incredibly short-sighted to force cuts into public health, public education, and public safety. And yet, that's the potential problem that we're confronting, and that's what I'm trying to avoid by hoping that and working to encourage Congress to take action. And it's my hope that the Republicans in town are reaching out to the United States Senate leadership as well as the White House to encourage them to move forward so we can avoid that. We recognize, too, that moving the tax collection back means that we won't know even when you look at the revenue estimating conference what precisely we're dealing with, which we would have a lot more information generally. And so it was July 1st is the right goal, but because of COVID-19, it is an unrealistic one at this moment, and that's why we've got to do the best we can with as much information as we have, and we'll know a lot more as we get closer to that timeline.
Then what is a realistic goal?
Well, we're going to have our tax collections in July this year. We'll know what we've brought in at that point. We should also know whether or not Congress and the White House were able to deliver on a fourth supplemental, and so we'll have a lot more information at that point.
Governor, I know we try to keep these focused on the pandemic, but we can't ignore what's happening in Minnesota and the events over the past several days. Would you care to weigh in on your observations on that, please?
Yeah, thanks, Rick. I think like many, I've been watching the news and just horrified by what we saw in the video. George Floyd's family deserves a thorough and timely and impartial investigation into the protocol and procedure and the events and circumstances surrounding his death. Every time something like this happens, whether it makes the news or not, it's just another reminder that we've not treated this broken component of our culture with the urgency that it demands. And there has not been enough urgency in doing the hard work that we need to do as a country to enact the cultural change. It's long overdue, and I cannot pretend that I understand the exhaustion or the desperation that African Americans across our country are feeling right now. Can't imagine being a mother who's afraid every time her son goes out in public that he might not come home. But what I do understand is that it's on every leader in this country to work urgently until we achieve that cultural change that's overdue. And it's incumbent on every one of us to stand up for what is right. We have to hold people accountable, people that perpetuate these abhorrent actions. George Floyd's death and the deaths of many others, Ahmaud Arbery, Trayvon Martin, Renisha McBride, they're not isolated incidents, but they're a part of a systemic cycle of racial injustice in our country. I thought this question might come, and that's why I wanted to jot down a few thoughts, because it is important that we get this right. The events of the last couple of weeks have really sent a clear message that Black lives are under threat every single day, whether it's the fear of law enforcement or the fear of this pandemic. And we cannot live in a society and a country where our rights and dignity are not equal for everyone.
Governor, can private and municipal campgrounds be open right now during the stay-at-home order? I know the FAQs you have on the website says no, but there are lots of private campgrounds still open and with seasonal campers right now, and many are staying closed for fear of losing their license from Eagle.
So, at this point, what I said earlier about the trajectory that our numbers have been on, if it continues this way, I'm optimistic that in the coming days we'll be in a position to take another step forward. It is absolutely, essential that we all continue to do our part. And I can't stress that enough because Michigan has been a leader in what we've been able to accomplish and people taking this seriously and doing their part. We need to continue to be a leader, a place where people know that we are disciplined, we take this seriously, and we are eager to get re-engaged. With regard to campgrounds, obviously the state campgrounds are not open. Private ones, some of them are. I just encourage people to continue taking this seriously. As you look to Region 6 and 8, we have left some of the discretion to the local officials and the local public health department to make sure that if they believe it's important to go slower, that they do. And we're encouraging them to look seriously and have some ownership over how quickly this pacing is. We have said right now we do not believe that it is safe to engage on that front, although I suspect in the coming days that may change.
What about Regions 5 and 7, who've seen kind of consistent numbers?
So, we actually have a call tomorrow to discuss the next phases of this re-engagement and what that looks like. I think context is always important, and that's a part of the discussion that we're having tomorrow.
Just to follow up on that, Governor, what benchmarks will you need to see in order to lift more restrictions?
So, obviously I'm working very closely with Dr. Khaldun and University of Michigan Public Health. Merck has articulated a number of things that they believe we should be looking at. But of course, it is
I
always
mean the Michigan Employment Relations Commission.
the Michigan Economic Recovery Council.
That one.
Yes, I know. We have a lot of things that sound the same. It sounds exactly the same because it is, but very different organization. So clearly we are looking at our ramping up of our testing. We've made incredible strides. We were under 5,000 tests a couple of weeks ago. Now we're almost up to 15 daily. That is a major stride. We need to do more. We have aggressive goals, and we're going to meet them. But there's additional testing we want to be able to accomplish across the state. That is critical to understanding the spread of COVID-19. As we are doing this testing, we have seen our numbers continue to decrease in much of the state. That is cause for optimism. Also, we are working to watch the number of beds in our hospitals, hospitalizations, death rates. These are all pieces of the data that we have to assess. But as I've said many times, and I'm sure I'll say it many times in the future, context matters. If you have 100 COVID-19 positive cases in a region, in one region that can be de minimis, although it's serious, we take it seriously. In another, it can be devastating. And that's why context matters. If it all happens at one point, a congregate care facility or a workplace, that is different than if it is randomized, spread across a community, which the latter is much more concerning. And so context is a part of the calculation as well. And I know that that's an unsatisfactory answer for people that just want to see numbers on a dashboard and know that something automatically happens. But that is the important aspect of what public health is and how public health works. All right. Thank you. Thank you.